Jumping to the next question, I want to ask you: do you think you get paid fairly?
I should already do a question before we did interview. Yeah. um, I think there is no limit in the money that you always want.
Yeah, we all agree with that,
Yeah,
right?
we always want more. We always want more, and a thing like that. I think like sometimes not enough because the ability to have a quality of life in line with your responsibility and the effort that you put in the study and the work is not balancing that. So I feel myself, like example in London, it's the quality of life. It can be very low because it's very expensive. At my age, because I failed, maybe sometimes also my fault. I couldn't get developed in a senior position, couldn't get better pay. It's for me practically impossible to own to buy a house or even rent a house on my own. So I've like 43, sometimes like sharing the toilet with some friends for the people that don't really know is a little bit demoralizing. And I say, why I'm here? And I say, maybe in another country will be able, maybe even in Italy I will be able to rent a house.
Yeah.
I was struggling maybe too because the pay is very low, but maybe I will still manage to have my sort of like little place.
And if you would have an opportunity to talk to the prime minister right now and to give him a number, what do you think? How much you should get paid, like to meet your
No comment.
needs?
No, miss my need. I
Like,
mean,
you have a number in your mind which you
no,
think would be fair, or
I don't have a real number. Um, I don't have a real number. I mean, um, but yeah, I think it will be just like to be balancing like what is the cost of living at the moment, and for sure there will be if there I know there is some attention and try to even like for nurses that give the chance to rent a council house or thing like that. For example, I apply for the council house because I say that's a good opportunity. Why don't I apply? And I'm still waiting after years for my application to get considered.
yeah, it
Even
get a
like
long time actually.
so, it take ages. So for the time probably it's gonna get considered, I will probably be bored and I will probably leave.
Yeah.
And maybe just go outside of London, maybe go to another country where they give me maybe a better opportunity, better or better, but like a place where to live, maybe for a decent quality of living. So yeah, I think it's more about that.
Yeah. Just we about to end. What's your professional goals?
Oh, my professional goals at the moment to stay in the profession.
Maybe something else in your mind, or for long term, or like,
mm,
or you simply want to still keep the job you're doing?
uh, not joking. Stay in the profession is the biggest one. I'm up and downs and like I'm thinking I should leave and totally change and do something else because I'm tired. Then sometimes I think just like, of course, getting into a senior position in my role now in intensive care. But there are a lot of things that I like. I mean, I like medicine. That's the biggest problem. I like, yeah, it's a big issue. I like medicine, I like the human body, how things happen in the body, the physiology and stuff like that. So I'm always interested in learning new stuff. So for sure, I would like to in the future to fly with patient, be like a fly nurse.
Yeah, interesting.
Yeah, fly around. I've been flight already. I flight already doing like a
Sound
repatriation.
much more exciting than
Yeah, a little
stuck on
bit.
the word. Yeah.
I'm always a little bit looking for excitement. You know, I always been always the kind of guy. I had the chance to work to fly in America, and I was like flying on helicopter and move patient with an helicopter and like
Oh, did you? Wow.
yeah, yeah. So it was a great. I was just observing, but I was in North Carolina on a flight there, so we were picking up patient from an hospital and bringing the patient to the main
To the major
hospital. Like yeah,
centers. Yeah.
like it would be my hospital where I work now. And or repatriate like or go and getting a patient in the middle of the street or flight and or getting it over from the ambulance staff, getting the patient on and getting the patient to the trauma center was a pretty cool job, and I the kind of job I like. I mean, I like a little bit of adventure. Yeah, so I will probably still point in that direction or doing even anything similar, like
Similar, yeah.
working like in a
Within
war
the same
zone.
industry.
Yeah, work in a war zone, maybe repatriate patient from there,
You
or
wouldn't mind, yeah.
yeah. I still wonder. I still. That's one of the main reason why I studied nursing. I wanted to go to the kind of environment, and just like, but then I didn't realize to go to get a kind of environment with the scale that they want. It was a long route,
Yeah.
and I had to learn a lot of stuff, and sometimes I don't feel ready yet.